Michelle from The Choice of Motherhood. I just wanted to do a slightly quick video on why IVF is a good choice for women with advanced stage endometriosis. That's stages 3 and 4. Please don't quote me on any of these statistics or anything like that. This is just what I've learned from my research, my watching different videos from doctors, talking to different clinics, and reading a lot of different papers. A lot of researching done in the last few days. So anyway, there was a study done in the 1980s that all they did was watch women with endometriosis and seen how many got pregnant naturally within a period of 25 months, so just over 2 years. During that time frame, what they found was women with stage 1 or 2, about 50% got pregnant on their own, naturally over that 2 years. Once they hit stage 3 though, stage 3 women, only 25% got pregnant naturally over 2 years. Once you hit the stage 4, there was zero. Not a single woman with advanced stage endometriosis got pregnant within that 2-year period. That's kind of shocking and kind of alarming at the same time, because I know for a fact that I am either stage 3 or 4 based on the fact that I have endometriomas in my ovaries, on my ovaries. I don't know exactly, but I have endometriomas, and once you have endometriomas, you know you are stage 3 or 4. So I have between 0 and 25% chance of getting pregnant naturally over 2 years. 2 years. Statistics for my age currently, for normal women my age, statistically, 80 to 90% of women my age get pregnant within 1 year. So I am going from an 80 to 90 to a 0 to 25%. Kind of shocking, because it's just scary to think that my chances of getting pregnant are so low. I read another thing, worked it out, that it's about 2% chance every cycle. 2%. For a normal woman my age, the chance is about 20%. So I'm from 20% down to 2%. So, and this is not just like getting pregnant like a chemical pregnancy. This is actually like getting pregnant and staying pregnant. So, chemical pregnancies happen so early in the pregnancy that they don't count as official pregnancies. So, that 2%, that chemical pregnancy doesn't even count as being, yay, I actually made it to that 2%. No, I haven't at all. And it's coming up on a year. I am on my 8th cycle out of 12. So I guess it's not totally a year. But you guys can see the correlation where I am nowhere near where I should be. A friend of mine who started trying to conceive a month after I did, who is a year older than me, she has had 2 chemical pregnancies and an ectopic during that time. So she has had fertilization and whatnot happen 3 times in less time than it's taken me to have 1. So I just want to kind of explain how endo affects getting pregnant, and go from there on why IVF helps with those issues. So basically, the first process in getting pregnant is getting the sperm to the egg. That involves going through the cervix, or in the case of an IUI, just going through the fallopian tubes. The issue with endometriosis is it often causes tubes to be blocked. So right there, the sperm can't even get to the egg, and it lowers the chances of pregnancy. So with IVF, how that helps is it bypasses the tubes and you're removing the egg straight from your ovaries. So therefore, there's a higher chance of pregnancy just because you don't need anything to go through your fallopian tubes. After the sperm actually gets through the fallopian tubes, if it does, next is fertilization. Fertilization with endometriosis can be more difficult with advanced stages because, especially if you have endometriomas, they affect egg quality. They also cause the egg to be more hard, like I guess hard is the word I'm looking for, but it makes it very difficult for the sperm to actually go through the egg and fertilize it. So You might be wondering how IVF helps that. Well, there's a process. I don't know the whole word for it. Yeah, I'm not even going to attempt it. ICSI is the normal term, ICSI. Basically what it means is they take your egg, they take the sperm in a needle, and they inject the needle into the egg and fertilize it that way. Usually when you see IVF stuff, like ads or photos, that's usually what you're seeing, is like the needle in the egg being fertilized. So it does cost extra money, but it bypasses the fact that the sperm needs to go through the egg, because the needle can obviously poke through a harder shell than the sperm can. So here, if you've been following my vlogs, here I've been saying, I know they fertilized because I had sperm there on the right time and everything. The reality is, I could have nothing getting fertilized even, because I know I have advanced stage, and therefore my egg quality could be affected, and therefore they might not be able to even fertilize. The other thing, even if you don't do ICSI, with IVF, because you have so many eggs, usually, you have a lot more that are going to fertilize in general. Say you have 15 eggs at retrieval, and only 7 of them fertilize. That's less than half of what was at retrieval, but the good thing is that you still have 7 embryos. So there's a good chance that one of those will be higher quality and be fine. So after that, you now have the egg transports down the fallopian tube, which hopefully is clear, and then implants. Endometriosis can cause issues with the implantation as well, which I'm not sure how IVF gets around that, possibly through medications that you're taking, possibly through just because if you have surgery ahead of time, it can help clear it. So I'm not sure how much IVF can help with implantation beyond that. But already you have an embryo, the embryo has been fertilized, it's going to be the highest quality embryo put back in. So you know that there's a higher chance of implantation just from that, versus hoping that nature took its own course and knowing that it was fertilized. So the last part of getting pregnant is staying pregnant. So once the embryo implants, usually you start producing progesterone. With women with endometriosis, we have high estrogen levels but low progesterone levels. So we often need progesterone support. With IVF, progesterone support is mandatory. Because of the way that eggs are retrieved, they actually cause your ovaries to not produce progesterone. So it has to be supported. The good thing with endometriosis patients is that the artificial progesterone is helping your body because you need it anyway. So it's going to provide that support to help that embryo implant and for you to stay pregnant. Different doctors say different amount of times they want you on progesterone, but usually between 8 and 12 weeks you're on it afterwards. Some are injections, but most are suppositories up your vagina. It is messy and gooey and apparently disgusting, but if it's going to help you support a pregnancy, with advanced stage endometriosis, there's all this stuff that the sperm and the egg need to get around and fight against in order to make a baby. With IVF, it helps a lot because you are taking away a lot of those obstacles and making it just easier for your body to be able to have a pregnancy. So anyway, I hope that helped explain kind of where I'm at with wanting to go to IVF and why it is a good option for people like me who have advanced stage endometriosis. Thanks for watching. Have a good day. Bye.